Hariom. So today we're going to look at diastasis recti, which is the split abdominal muscles, and this is important for us to know about as yoga teachers because we want to make sure that our new mothers in their postnatal recovery are going to be practicing yoga that is going to help them and not make this problem worse. So we'll have a look. So what is it? Okay, so you can see the picture of the normal abdomen and you can see the separation of the abdominal muscles, the rectus abdominis. This is occurring during pregnancy, but then it should start to knit together again after the pregnancy. So here you can see diastasis means separation. Recti refers to your abdominal muscles called the rectus abdominis or the six-pack, which is holding in your organs and helping to stabilize the core along with a few other types of muscles. So basically the connective tissue between the muscle gets stretched out and it allows that rectus abdominis to pull apart and separate down the middle. And sometimes the tissue does heal and the muscles come back together after delivery. Very, very commonly it does. However, it doesn't always happen. And so here you can see if it doesn't happen in 3 to 6 months, you'll end up with a gap that doesn't close unless you do treatment. And studies have shown that about 40% of women have diastasis at 6 months postpartum, which is actually really huge. So it's actually very, very common and we need to know how to help. So after pregnancy, a diastasis recti looks like a ridge, or it can look like a loaf of bread protruding from your midline. It becomes more prominent when you're straining. So if you're coughing, if you're sitting up from laying down in supine and you immediately sit up, and it kind of looks like the belly, just the pregnant belly that's still a little bit podgy and big. That even when you do exercise, it doesn't seem to be making a difference. So it is hard for people to know about it if they don't know the test to do to check. And because postnatal care is very different in every country and even within countries, depending on what doctor or midwife or nurse one is having postnatally, women don't know about it and they don't talk about it. So a lot of women have never heard of this issue before. And okay, the next point, it may disappear or cave in when you lay down or relax your abdominal muscles. So this is what it is. Now looking at who is at a higher risk. So women who don't exercise as much, so their core muscles are quite relaxed, not very strong. But also you'll see over-exercise in the first trimester when they're really overdoing it. So it's important that we do have exercise, but not too much. So the right balance. Then women who have multiple pregnancies. So here I mean if they've got twins or triplets, and also if they've had many pregnancies. So especially if they've been close together. So if they've been within 2 years of each other, the body may not have had enough time to recover before the next pregnancy comes. Then also women who are over 35, just a higher chance, and women who have a larger baby. So especially, it can be a quite small framed woman, but if she's got a really big baby inside, then it's going to be more stretching of her body. So those are the women that are going to be at a high risk. And looking at the side effects, so there's lots of variety in side effects. Chronic lower back pain is one of them, and that's something that is again pretty common in postnatal women. Urinary incontinence, constipation, pain during sex, pelvic or hip pain, mental stress, low confidence, insecurity. So that's especially about how her belly is looking. Even if she might have been doing all these crunches and things like that, which aren't really helpful, they're not helping. And she can be feeling very stressed that why is my belly still there when I'm doing all of this abdominal work, all of this core work. So you'll see. So how do we actually avoid it? So making sure that before she becomes pregnant, she is doing regular exercise. That's important. Not having really strong abdominal exercise during pregnancy. So of course it is definitely necessary that she does do exercise, but it shouldn't be really, really tough. And then making sure that when she sits up, she doesn't sit up from supine and just sit up. She rolls onto her side and then slowly sits up, because this the way that we move up from supine, if we immediately sit up, we're really contracting our rectus abdominis more, and we don't want that. Then avoiding rib thrusting. So this is what often many pregnant women do, is where they have their hand on their hip and they push their belly forward, and it creates more of a curve in their lower back, and it really makes their posture go all out of whack. But it has been found, it has been linked to the split abdominal muscles as well. So taking care of her posture is really important. So how to check? Now, the good thing is it's quite easy to do this, and one can do it themselves. So basically you're just laying on your back, bending your knees and keeping your feet on the floor. Then you want to put your hand on your belly and you want your fingers on your midline at your navel. So you can try feeling for it below your navel, but you can also try it above your navel. It's definitely a little bit more common below the navel, but it can be both. And then what you're going to do is you're slowly going to start lifting your head up like you're doing a crunch, okay, like one of those types of sit-ups. And at the same time, you're pressing your fingertips down towards, the line between the abdominal muscle. And when you're sitting up, this is going to cause your rectus abdominis to contract, and you'll be able to feel if there's any separation. Like basically it's going to be going down in the middle, but then you shouldn't be able to feel a lot of separation there. It's normal that you might be able to get like one finger in, but it shouldn't be more than 2 finger widths. So you'll feel the edges of the muscle, and it can be as much as 5 or 6 finger widths, which is quite large. So it's a really easy way to be able to check if you have it, and you can also check your pregnant women, sorry, not your pregnant women, your postnatal women. You can check how it is, and if it's knitting together or whatever, you can work it out. So that's a good way. Okay, so you'll know for sure if she does have this problem. So I would actually recommend that you try it yourself as well, because even if you haven't been pregnant, it's still you'll get the idea and you'll get the feel of it. So you'll notice that there is a dip where you put your fingers, but then there shouldn't be a gap, a big gap, not more than 1 centimeter. So what kind of things do we want to be avoiding if we have this problem? So any movement or exercise that places strain on the midline or causes the belly to bulge outward. So things like sit-ups, so all those kind of sit-ups and crunches, the plank. So that's something that we need to take care of as yoga teachers, because if she can't do the plank position, then she shouldn't be doing things like Ashtanga Bandha, she shouldn't be doing Surya Namaskar, because of that outward bulge. So here you can see this quote: when this action is repeated forcefully and frequently, the degree of separation can actually worsen. So, she might think that, oh, I'll do lots of sit-ups, that'll make my tummy all flat, but it's actually making it worse, unfortunately. Then, of course, heavy lifting. If she's lifting a lot of things, it's going to be straining. Any kind of strong back bends and strong twists she should be avoiding. Okay. Definitely crunches, like I've said, like similar to sit-ups. So they're going to be pushing the muscles further apart and tightening the muscles and stretching the connective tissue. So we don't want that. We want to be knitting the muscle together. Then things like the supine boat, where the head and shoulders are lifted. So when we do that, we're using that muscle more when actually we want to start using the transverse abdominis in our core, using that core muscle instead, which is going to have a healing effect. So all that kind of boat sit-up type stuff. Basically, if you think of any kind of position where you're getting that bulge in the middle, that's what we don't want. And even taking care with really strong deep breathing. So strong deep breathing will increase the pressure in the abdomen. So if you are doing deep breathing, you just want to make sure that it's very relaxed. So you're not going to do like inhale 10, exhale 20. You're going to stick with 4:4, 4:6. So it shouldn't be intense. And in fact, it will be better to do the full yogic breathing. But we'll talk about that in a moment. So what to do? So abdominal compressions like simple Uddiyana Bandha. So this is what we've already seen in class, where we're laying down in supine and we're just gently pulling the belly in as if we're trying to press our lower back into the mat and pull all the muscles towards our spine. So that abdominal compression is really helpful. Then we do things like Ardha Chakrasana, so like the bridge pose, but we don't raise the leg up, we just stick with the first one. You can also have a block between the thighs, which can be helpful too. Then we've got our pelvic tilts. So we've done them in Tadasana, the pelvic tilts, laying down on our back with our knees bent. So that movement is very helpful. We can also do it against the wall, but I would always go for the floor if you can. And then we have leg slides. So again, this is in the same position, Tadasana, and you're pressing your belly down and slowly sliding one leg away. So you start to straighten that leg and then you bring it back. So that's known as the leg slide. Basically, you want to be utilizing your deeper core muscles, so the transverse abdominis and the obliques, as well as the pelvic floor. So instead of just that six-pack. Then we've got the wall squats. So we did them in the pregnancy classes. So the wall squat, not turning the knees out, we're just keeping the thighs like parallel to each other and using the wall, slowly squatting down. Then there's another movement that is very helpful. So I have to explain it a little bit more because you might not understand just from reading that sentence. So basically, you're laying down on your back, you bend your knees, and then you bring your knees to one side. So like we're doing that knee movement too, the nice twist, supine twist. But then what you do, so you have your hands behind your head, you know, like you're going to do a sit-up or a crunch. And this is a crunch, but it's different because you don't have your knees up. Your knees are to the side, so you're relaxing your legs down. So you might have to adjust your position a little bit so that your knees can go down. And then you're doing like a tiny little sit-up to the opposite side. So if your knees have gone down to the right, then you're going to start sitting up towards your left hip. Okay, so you don't want to be doing it towards the right side, you want to be doing it to the opposite side. So that is a really nice one that my midwife, who is now my friend, showed me, which is very helpful. Then we have supine toe taps, which is also another one she showed me. So this is, again, similar to the leg slide. So you're in Tadasana, and then what you do is bring yourself close to the wall so that in Tadasana you can lift one leg and you can tap your toes just to the wall. So you need to have enough distance that you're stretching out your leg so that you can just get your big toe touching on the wall, and then you bring your foot back. So that's one version of the toe taps. The other one is that you keep both knees bent, your feet are on the ground, and then you lift up one leg and tap your big toe onto your opposite knee, and then bring your foot back down again. So the toes, say for example, I have my knees bent, I lift up my left leg and I place my left big toe onto my right knee, and then I again bring my left foot back to the ground. So that's the other version of the toe taps. Then in a sitting position, so a cross-leg position, we can do what we call like core circling. So this is just where you're just rotating. So you're keeping your hips in the same position and you're just rotating your core. So imagining that you've got a circle and you're just going around and around and around. So it's just focusing on the core. So that can be helpful. And here I've just written practices using the deeper core muscles, the transverse abdominis, as well as the obliques and pelvic floor. They're the ones that you want to be doing. And that's why it's important to build up really slowly with the practices. And for all core work, you basically want to be strengthening from the deeper levels out. You don't want to just focus on the outer levels. So a lot of our asanas that we do, we just go very slowly. We use variations, and even things like the one leg cat. You know, once she can stabilize her spine and she can keep her spine in a neutral position, she can pull her belly upward, then even that can be really helpful too. And the last point here, whole yogic breath instead of deep breathing. So using her ribs as well. So she's got chest breathing, clavicular breathing, and abdominal breathing. But still making sure that it's not going to be too much pressure into her belly. So those are the things that we want to. And the last point here is surgery. So this is an option, but it should really be a last resort because it's the option of knitting the muscles together, stitching together basically. But it does mean that she can't have another pregnancy, because if she has another pregnancy, she needs to be able to create that space in her belly, and she won't be able to if she's had that surgery. So it really is a last resort. And there are lots of practices that can help, but we just need to understand what not to do and what to do. And I would also recommend that if a woman does have this, that she should also talk to her physiotherapist or physical therapist, and also get some different exercises from that person as well, because it's useful to have a combination of practices which will help to heal this issue. Hurry on.